Hi, my name is Sage Smith, and for my 5th SportsMed 3 project, I did a medical research project on age-related eye diseases. My thought process when picking this project was to understand more of what my grandma is going through, since she suffers from all of the diseases I'm going to explain, and now I have a much better understanding of how difficult it is to live with eye diseases, as some of them affect both the peripheral and central vision. Visually impaired individuals enter nursing homes 3 years earlier, have twice the risk of falling, and have 4 times the risk of hip fractures than those who don't suffer from visual impairments. I think that this statement is the reason why eye diseases are so important to understand and so important to learn how to fix. The first eye disease I'm going to discuss is age-related macular degeneration, or AMD. This picture shows what visually people that suffer from AMD see. On the left is what a normal person sees, while on the right is what somebody with AMD sees. What is age-related macular degeneration? It is issues with the macula, which is a part of the retina that causes the loss of central vision. And there are 2 forms of AMD. It's either dry AMD or wet AMD. Dry AMD is the more frequent impairment, as 80% of all people with AMD have this version, and this means that the macula will get thinner over time and drusen, or clumps of protein, form which cloud the vision. And wet AMD is when blood vessels hemorrhage under the retina, which can scar the retina, and with wet AMD you lose vision faster than with dry AMD. What causes AMD? Well, AMD is age-related, can be genetic, and the probability of getting AMD increases with oxidative stress, hypertension or high blood pressure, obesity, smoking, heart disease, and high cholesterol. And the picture in the background is another example of what people with AMD see. What are the symptoms of AMD? So AMD will reduce central vision, although the peripheral vision will remain intact. Drusen will appear and cause blurry vision, and they appear as white or yellow dots. And also hyper and hypopigmentation of the retinal pigment will appear in the patient's eye. How is AMD treated? At the moment, there is no true treatment for AMD, although there are preventative measures. Since the risk of AMD increases with obesity, nutritional supplements during the early stage can help slow the process. For example, vitamin C, E, beta-carotene, zinc, and omega-3 fatty acids can help slow the process. Why is AMD an issue? AMD is the most frequent cause of blindness in the Western world. The second eye illness I researched is cataracts, and this picture shows what cataracts look like in a person's eye. What is a cataract? According to the American Academy of Ophthalmology, a cataract is when your eye's natural lens becomes cloudy. Proteins in your lens break down and cause things to look blurry, hazy, or cloudy, and as well as decreasing the amount of color you see. So on the right, the line down the middle to the left is what a normal person sees, and to the right is what somebody with a cataract sees. What causes cataracts? Aging, trauma, and intraocular inflammation, or inflammation of the eye, cause cataracts, as well as malnutrition, especially not enough antioxidants, and ultraviolet radiation, although this mainly affects cortical cataracts, which are not as big of a deal. Systemic and topical steroids can cause cataracts, although mainly chronic steroid use, and smoking can possibly worsen. The symptoms somebody with cataracts will experience are silver-looking masses in their eye. It'll become hard to read, hard to see objects at a distance, and halos and glare will appear around lights. It will also be difficult to walk upstairs and just walk in general, and it's hard to see in too bright light or too dim light. How are cataracts treated? Cataracts are treated by cataract surgery, which is a small incisional surgery, and this gives fast recovery, improvement in eyesight, and minimal amounts of complications to patients. Although if they suffer from pediatric cataracts, which is not age-related, the road to recovery is longer and their overall eyesight improvement depends on their post-op care. Why are cataracts bad? According to Europe PMC, cataracts are the world's leading cause of blindness. This is largely due to other countries not having access to the surgical instruments that we have to in the Western world. The third illness that I researched is glaucoma, and you can see how red this person's eyes are, which is an indication of glaucoma. What is glaucoma? Glaucoma is caused by intraocular pressure when it's greater than 21 millimeters of mercury, which is how pressure inside of the eye is measured. It can either be congenital or hereditary, which is diagnosed as a child or at birth, primary open angle, primary angle closure, and is caused by cupping and atrophy of the optic nerve head and characteristic visual field loss. Since high intraocular pressure causes glaucoma, this induces damage to the optic nerve, and the high pressure inside of the eye is caused by an imbalance in the production and drainage of fluid in the eye, or aqueous humor, according to WebMD, and the picture in the background demonstrates the different severities of glaucoma and how a patient's eyesight is. Symptoms of glaucoma include severe headache, eye pain, nausea and vomiting, blurred vision, halos around lights, eye redness, and a loss of peripheral vision. And the eye on the left is an example of somebody with glaucoma in their eye. Unfortunately, the vision loss caused by glaucoma cannot be recovered, although if it is recognized early, vision loss can be slowed or prevented, although this induces a lifelong treatment of glaucoma. This is done by lowering the intraocular pressure by using prescription eye drops, oral medication, laser treatment, surgery, or a combo of all of these. Why is glaucoma bad? Glaucoma accounts for 10% of all blindness, according to the World Health Organization. To tie back to sports and the importance of vision in our everyday lives, a research was done at the Tunisian Research Laboratory where the analysis revealed significant main effect of vision. Static balance was better when athletes performed the test with open eyes than with eyes closed, which also shows how awful it is when people lose their vision because they can't do anything the same way that they could before.